Back now on Triad Today, and I'm excited about having this guest with us. This is his first visit to Triad Today. J. Paul, our director, if we can meet the distinguished Dr. Michael Kalish. He is with Deep River Family Medicine and comes to us courtesy of the good folks at Cornerstone Healthcare. And we welcome you to the program, Doc.
Thank you very, very much, sir.
You had sent me an email, so let's talk about an on-site clinic. And I didn't know at first what you were referring to, but now we were chatting before we started, and I understand exactly where you're going, because I remember in the old days of industry and companies, they would have doctors and nurses on staff or come by and doing physicals. But in this case, what are you considering an on-site clinic?
Well, an on-site clinic right now for us is where a big group like Cornerstone can place actually a nurse practitioner or physician's assistant on the side of a campus of a large employer in the area and provide them the medical care that their employees need. And
so you would have, let's say, a PA, a physician's assistant, in every day at a company?
Well, it depends upon what they need. If it's a company fairly large with 1,000 employees or greater, then they may actually be, it may be warranted to have somebody there every day for 8 hours a day. Smaller companies may only want 3 or 4 hours a day.
And of course, you're hooked in through your computer system. Cornerstone has a great system for that, so you can keep up with all the information on each patient, right?
Absolutely. It provides a great oversight of the mid-level providers to make sure that they're providing great care.
What is I know it sounds like you and I are trying to sell this concept, but I am, because I think it's great. But I mean, tell me what the benefit is to the company and the benefit to the employees.
Okay, well, for the company, I think it's pretty clear that it can be unparalleled in the respect that people can get to the doctor, get to the provider right away with no problems with access, right? I think it's a great retention tool for the employer. People love to go to a location where they feel like the employer cares for them.
Exactly.
I think that...
Just like companies that put daycare centers in. I mean, you feel more welcome there. So
absolutely. And I think generally, too, from a preventative medicine standpoint, we can develop all kinds of programs to keep the patients healthy.
Yeah, because, I mean, wouldn't you say it's true? And I'm a guy who's way, way over 50. I'm 80 now. But once I turned 50, 100 years ago, I mean, my wife had to just cajole me to go get the colonoscopy and whatever. But if I'm working in a company, and working around my colleagues, and we have a PA there all the time, and the doc comes in and says, hey, you need to get this checked out. This is what, I think you've got some personal contacts, some personal nudging. Don't you think people are going to be healthier because of that?
Oh, absolutely. Especially some of the companies that we go to have typically employees that may or not be very educated about how to get the health care, may not have the energy, may not have the money to be able to access it. And I think that by making the situation very comfortable for them, they can establish a relationship with a physician or the mid-level provider that they may have never ever had before, which then increases the likelihood of utilizing the service when they need it.
If I'm an employer and I have 100 employees or something, and I'm going to ask you, say, hey Doc, what exactly kinds of services on a day-to-day basis or weekly basis would the PA offer? What are my folks going to get routinely?
Well, routinely, if we can establish a full service clinic at the location, pretty much anything you can get at a regular family practice office we can do. Anything from breathing tests to EKGs to physical exams, pap smears, whatever. Just requires a little time to set the whole thing up for folks.
Do you, are these clinics a good place? I think we've already touched on this, but let me expand on it a little bit in terms of preventive medicine. Is it something that you encourage? You try to do education as part of that package in terms of smoking cessation or diet, or let's check on mammograms, and let's check about your family history? I mean, are you going to be big on preventative medicine and family histories?
Absolutely. The biggest selling point I think that we have to help employers is the fact that with our electronic health record, because we put everybody who was seen at the clinic in the record and gather data such as their weight, and therefore can calculate their obesity or BMI. We can document if they're smokers, not smokers, high blood pressure, diabetes. Use that information to kind of set up a preventative plan, so we can decide based on those number of things we find, where does the employer want to focus on to be able to make their employees healthier.
Right. Now, what if, again, I guess the last question is, if somebody's running a human resource department in a company, they see this program and they hear about it, what's the first step they do? Is there a website, or is there a phone number? Is there something they should do?
Well, I suspect, depending upon where you are on the Triad, you probably could ask any local big group to go ahead and put a mid-level at the site. But I got to be honest that with everything that Cornerstone Healthcare has to offer in terms of the advancement in our electronic health record, the number of facilities we have through the community, that I like to think we're a good place to start.
Good, yeah, excellent. And of course, up on screen already is the cornerstonehealth.com website, so check that out. Dr. Kalish, will you come back sometime?
Absolutely.
Thank you. You're sort of our on-site doctor now.
I am.
All right.
Need a shot?
We're going off? No, I don't need a shot. Not what you're thinking about. We'll be right back after this.